Oh, hey, are you having deja vu? No. Welcome to Real Talk with Rebecca. This is episode 1, part 2. The first part of this, which I just finished recording a minute ago, was like 45 minutes long, give or take. So, because this is a lengthy topic and I have personal experience with it, and I have friends that have personal experience with it, I discussed Amanda's story in part 1, and we will be discussing my story in part 2. And if I need to record a part 3, I might just do that today too as well. So this is the third video that I have recorded today. So if you're interested to learn more about strokes and my personal experience with them, then keep on watching. Now, I know I'm wearing the same shirt and the same makeup for the third video in a row today, but you know what? I really don't care. I don't care. Because after I get done recording this video on strokes, I'm going to go empty the dishwasher and put the dishes away, eat something, wash my makeup off, and crawl back in bed for a few more hours of sleep because the 4 that I got just wasn't enough. So sometimes I record multiple videos in one day and you just don't know because I just changed my shirt. But when I get up from my nap, I will probably record another video, and I might just throw on another shirt just to confuse you guys so that you don't know that I recorded 2 makeup looks in one day. That's how I roll. Alright, so again, just like with Amanda's, I wrote mine out, except for I didn't realize how much of my story I wrote, because like 2.5 pages of this are my story. Like both of these full pages is my story. Now this was all of Amanda, and then like 2 lines on this page is Amanda, and then the rest of it's mine. I feel kind of bad, but hopefully you guys are enjoying the Real Talk with Rebecca. I won't know because I'm recording this back to back, and I don't have any feedback yet. I haven't even edited yet. Hell, it's still on my computer. I'm on the computer. I need to go to bed, people. What time is it now? 9:15. Yeah. Coffee's wearing off, and I'm still drinking coffee. It ain't working. Okay, so my own personal experience with strokes is different than anybody else in the world, because I've got a whole lot of other shit that kind of happened first, and a lot of it was out of my control. So I'm going to get into that, talk about what happened, what I went through, how I felt, those kinds of things. So if you're interested in learning about my experience with the stroke, that must be the garbage outside I hear, then keep on watching, because that's what this is about. And I wrote this down, and I might just read this verbatim because not only is it my story, but it'll keep me on track and going off into a diatribe unless I have to explain something. When it comes to my own history of health issues and strokes, it is not a pretty story. I went into the doctor one day with what I thought was a pulled muscle. I was actually working at a salon, and I had a client come in who had cerebral palsy, the ones that have, she had a motorized chair, and I had to move my chair every time she came in to get her hair done. It was her birthday, so we were doing something extra special, so pulling the chair caused what I thought was a pulled muscle in my groin. So what I thought was a pulled muscle, went in for testing for that, and found out I had a disorder called lymphadenopathy. Basically, it's a precursor to lymphoma, as some doctors believe. So lymphadenopathy, I actually have a thing that I pulled for reference so that I will just read it to you. Basically what it is a pissed off lymph node. You have over 200 lymph nodes in your body. What is it? Interstitial, something. When you have a lymph node in your groin, it's called something specific. It's probably in the article, and I'll probably put a picture on the screen. Usually you'll, like when you get sick, the lymph nodes in your throat will swell really bad, and that sometimes it also happens when you have allergies, when you have a cold, a flu, any type of like strep throat, tonsillitis, any of those kinds of things. You're going to have like the nodes in your throat swell up. When you're pregnant and nursing and producing milk, you're going to have the lymph nodes in your armpits swell as well. You have, like I said, lymph nodes in your groin, where your pelvis is in your lower back. That is where your lymphatic system is basically housed. And what that does is it pumps fluid throughout your body to keep you lubricated. And whenever you're sick, things become swollen and irritated and pissed off and angry. With conditions like lymphadenopathy, you'll have like a random lymph node behind your knee swell one day. And other days you'll have one in your armpit swell up. And then you'll get one in your neck that swells up, or your groin, or your lower back will hurt and burn and be irritated. And you're like, what the fuck is going on? You're like, I'm not sick. I don't know what's going on. Well, lymphadenopathy causes what the basic definition of lymphadenopathy is: the abnormal swelling of a lymph node. There you go. Abnormal swelling of a lymph node. Yes. Can it be cancerous? Yes, it is. It is a precursor to lymphoma. Okay, so now here it says, although the findings on lymphadenopathy sometimes raises fears about serious illness, it is in patients seen in primary care settings usually the result of a benign infectious cause, again, cold, flu, allergies, strep throat, tonsillitis, those kinds of things. Localized adenopathy should prompt a search for an adjacent precipitating lesion, generally lymphadenopathy. In general, lymph nodes greater than 1 centimeter in diameter are considered to be abnormal. I'll put a ruler on the screen so you can see how big a centimeter is. It's not very big. Supraclavicular nodes are the most worrisome for malignancy. A 3 to 4 week period of observation is prudent in patients with localized nodes and benign clinical picture. In other words, if they do a CT or an MRI and it looks ugly, they're going to continue to watch it be ugly for a few weeks. Generalized adenopathy should, or adenopathy, however you want to pronounce it. I always pronounce it adenopathy. When a node biopsy is indicated, excision biopsy of the most abnormal nodes will best enable the pathologist to determine the diagnosis. For obvious examples, a child who presents with a sore throat, tender cervical nodes, and positive rapid strep test, or the patient who presents with an infection in the hand and the axillary lymphadenopathy. In other cases, the diagnosis is less clear. Basically, they're saying that injury can also cause the lymph nodes to get all pissed off. It says approximately inguinal. That's the ones for your groin. Inguinal. There's a picture here. I'll just probably swipe it and put it on the screen. The body has approximately 600 lymph nodes, but only those in certain like regions are more pronounced, like the ones here and the ones in your armpits and whatnot. So you have the head and neck has 55% super clavicular, axillary, which are these here, and then you have inguinal, which is your groin. And then there's like epidemiology and other things here that talk about, you know, what it's related to and relevancy and all that kind of lovely fun stuff. Again, I will leave that link down below. It can be linked with other cardiovascular disorders. So, yay. Whoops, I didn't mean to turn that off. Okay. So now that we know what lymphadenopathy is, and it can, and mostly usually does, turn into cancer. And once you have cancer in your lymph nodes, you just better just bend over and kiss your ass goodbye, because you're basically dead anyways. Because your lymphatic system is what keeps your immune system going. It's bad. It's horrific. And I have watched people with lymphoma slowly waste away to nothing because their body cannot fight off anything. Even a paper cut could kill them. It's bad. Horribly bad. Okay, so sometimes you can also get it from low iron, but usually it's from some sort of infection. Okay, so at the time my iron was like 24. The doctor was like, well, I was prone to strep throat. I still have my tonsils and adenoids and all those lovely fun things. Lord knows what the hell they do. Doctors still, I guess, don't know. So between the fact that I have chronic allergies and I'm constantly getting like strep throats and stuff like that, and I have an iron deficiency, they did diagnose me with severe anemia. My iron was 24 when they did blood work. They ended up sending me to a hematologist oncologist, which usually you have a hematologist that just works with blood disorders, and then you have an oncologist that works with cancer patients. Or if you have a hematologist oncologist, then you have a cancer doctor that works specifically with blood disorders. So hopefully that explains that. So my doctor was a hematologist oncologist. She was a cancer doctor who worked specifically with blood conditions. So she put me on, actually, I'll be right back. I had to get some show and tell. Okay, so she put me on 325 milligrams of iron 3 times a day. And this is ferrous sulfate. And this label's faded, but kind of, whatever. Okay, so 325 milligrams of iron a day. So I was supposed to take these 3 times a day. And this is actually what's left of my prescription from like 2018, and I haven't, the bottle's full. Yeah. Am I still anemic? Probably. Have I been back to the doctor? Nope. Do I take them anymore? Every now and again. Okay, so I was severely anemic. She put me on the iron supplements, and I've been on those for over a decade. Just so you're aware of how long I've been taking that high dose of milligram for iron. So you figure 325 times 3. That's like 975 milligrams of iron a day. By the way, if you've ever worried about constipation and you, or if you have diarrhea, just take an iron supplement. You'll get over that real quick. So she put me on that while she was doing blood work for other conditions. I was tested for MS and lupus and a whole bunch of other conditions that they can do by blood testing now, which I think is actually awesome. Before there was no real definitive like tests that you could do for like MS and lupus, and now there is. They also tested me for Crohn's disease because I have symptoms of Crohn's disease. Thankfully, I don't, or at least at the time I didn't. Could I have developed it since? Possibly. But I have fibromyalgia, and it has a tendency to like mimic other conditions. So, while undergoing treatments for these things, I had been newly married to my second husband, which was a very big mistake. And if you've ever watched any of my other videos and heard me mention him, you understand why. And I had a pretty nice life insurance policy. Yeah, $500,000 worth of life insurance just on me, and $250,000 on my daughter. But I would say that was pretty nice for somebody who didn't have a job when he married me. Yeah, I was working like 90-something hours a week and going to school and raising a child on my own, and was making very good money. Long story short, he tried to kill me for it. Okay, you're probably a little confused. Let me break this down. First issue with my ex was giving me belladonna, aka deadly nightshade. Okay, wait, maybe that's a little bit too much. Let me back up. Okay, so for those that don't know, vitamin C helps your body break down and digest iron. So if you do like baked potatoes, broccoli has high amounts of iron in it, spinach, just some of the common foods. Usually I would do like potatoes with broccoli on it. In order to get your body to break down the ferrous sulfate, which is iron, you need, and there are 2 different types of iron, by the way, that our body can break down, and ferrous sulfate is the lesser of the 2 evils. It's easier for us to digest it. But if you do vitamin C at the same time that you are ingesting things with iron in it, like broccoli and potatoes and spinach and stuff like that, or a vitamin supplement that is made out of iron, your body will break it down a little bit easier and allow you to absorb it. Your body doesn't naturally break down iron. You can take iron and it goes right through you. If you don't have enough vitamin C in your system, your body just won't, it'll just pass it right through. It doesn't break it down at all. And our bodies do have a very hard time of breaking down iron and converting it into usable iron. So anything to help is always a bonus, which is what my doctor had suggested. She said drink 8 ounces of orange juice every morning when you take your meds, and then make sure you drink 8 ounces of orange juice at night to help you digest the pill at night. And of course I took one during the day. So I was taking them 3 times a day. So now that that's out of the way. So back to the first issue was my ex-husband giving me belladonna, aka deadly nightshade. you're still kind of confused about that, I'll put a picture of how pretty the plant is up here. It does grow not wild here in Florida, and it has these very pretty, like, little dark, purplish, black, blue berries that are about 6 millimeters in diameter. And they have no taste and no scent at all. And 4 berries is enough to kill a child. So I'll let you mull on that for a second. You ready to move on? Okay. So every morning I would, get up, get my daughter ready for school or daycare. I would have to get ready for work. I would have to get a glass of orange juice and drink my orange juice while taking my meds, while getting ready and stuff like that in the mornings. So in order to cut down on time, Ryan would do like breakfast and stuff, and he would be in the kitchen and I would be outside of the kitchen. Not that I don't mind cooking. I actually enjoy cooking, but it was his way of helping out because he didn't work at the time. He wasn't working. I was the one working. I was working in a full service salon. I was booth rent. And so somebody had to not only pay the rent for the house I was living in, but also had to pay the rent for the booth that I was also renting. So I had to work. I had to go to work, but I was doing pretty okay. So he would make breakfast and bring me my OJ and my meds every morning, because the medication stayed in the kitchen, right next to like where my keys and stuff were, so I would just grab it and go. So it was just easier for me just to grab the whole bottle and walk out the door with it. So he would make sure I got my orange juice and my pill every morning. Well, little did I know that he was crushing up the belladonna and putting it in the glass of orange juice, trying to kill me. So I'd been on those treatments for a few weeks when I started feeling like tired and drained and lethargic, and my brain was like, huh? I mean, I'm sure you've had those moments. I know I've had quite a few of them. The moment where your brain's going, and you're like, oh my God, would you just wrap your head around it eventually and stop being such an idiot? I mean, really, I've had these conversations with my brain. Okay, so you're probably going to get tired of hearing me say okay and so. Sorry about that. I'm not. I'll probably do it a dozen more times. I want to make sure that I'm keeping up with what I wrote, like where I'm at in the story. It basically just says, I would take my iron and drink my OJ while I got ready, and after a few weeks I was super tired and could barely stand on my own, and I just felt ugh all the time. Long story short, he was trying to kill me, and he was. He even admitted it later. With him giving me the nightshade, it weakened my heart, and I ended up having a myocardial infarction in 2007, and for those that don't know, that is a heart attack. Yay. Belladonna is really good if you know how to use it. You can use it as a sleep aid, or if you watch Practical Magic, you can watch how to kill somebody with it. Belladonna used topically can help rejuvenate the skin. It can cause your blood vessels to constrict, and it also causes a slight appearance of skin tightening. Again, not to be used over abrased skin or broken skin or anything like that, because it is toxic. It's deadly. So it's like eating the leaves off a tomato plant or a potato plant. You get strychnine. Deadly. Very deadly. Don't ever eat the leaves off a potato or a tomato plant. It'll kill you. Just like eating a peach pit. It'll kill you. Don't do it. Don't eat apple seeds. Enough of those will kill you as well. Anyways, trust me, I've done a lot of research on things that grow naturally that you could kill somebody with, because I just wanted to make sure I knew what the motherfucker was going to do next time he tried to kill me. So, now we're up to my heart attack. So this is where all the problems started. I had a heart attack. I lived about 7 minutes max drive distance away from the hospital. I don't know why my nose is itching. I was rushed there with shortness of breath, severe pain in my chest, arm, and side, tingling and numbness in my hand, all on my left side. Again, if you've seen part 1, you'll understand what that means. And more. Once I got there, they did everything that they could to stop my heart from doing its thing. I had an aspirin put under my tongue, and why did it change my aspirin word to aspiring? Really? Like, how many typos am I going to find in this? Good thing I'm, like, reading this now. I did read it before when I typed it out, but I guess I missed a few things. Because I will be turning this into a blog, so it's nice that I'm finding these errors now. Which, by the way, for those that don't know, I'm allergic to aspirin. So when they put me back in the ER, they gave me an aspirin and told me to hold it under my tongue. Yeah, I then had breathing issues. I didn't know I was allergic to aspirin because I'd never taken one. So that was fun. No, it wasn't fun. Okay, so I had an aspirin put under my tongue, which caused an allergic reaction, allergic to aspirin, which caused other medications to be taken off the table for use. I don't remember much, but lots of beeping and people talking and rushing and poking and all sorts of fun chaos. I'm sorry for being pedantic. They did an IV push of medication, and I had a reaction to that, and it completely stopped my heart. So technically the hospital did kill me, even though I was already having a heart attack, but the hospital technically did kill me with the medication. Has that sunk in yet? And yes, I've called a lawyer. I've hired a lawyer at one point, and because I was allergic to a medication, and I didn't know I was allergic, I can't hold the hospital responsible. So that would have been a nice payout, though. Had I not survived, it would have been an even bigger payout, possibly. Okay, so I missed something. Okay, so I didn't know I was allergic to aspirin. They did give me Benadryl to help with the swelling of my throat because I was asphyxiating. So, yeah. And I, like, completely freaked out when I was wheezing and whatnot. I mean, I knew I was allergic to shellfish by that time, but I didn't know I was allergic to aspirin, so that was fun. That was something else I could add to my list of allergies that caused me to go, yeah, not fun. Not that I really want to eat lobster or crab or any of that kind of stuff anyways, but, you know. Okay, so they did the IV push of medication, and I had a reaction to it, and it completely stopped my heart. And for those that don't know, my mom's sister is an RN. Well, both of her sisters are RNs. My aunt was the director of cardiac care at the hospital that I was currently at, having a heart attack. And because I had been to that hospital before, and my youngest was born in that hospital, and I'd had other surgeries done at that hospital, they knew me, and my aunt was listed on the paperwork as a relative, and she was working, so they called her down after my heart stopped. And if it wasn't for her, I'd be dead. Like, DED, dead. Like, completely not breathing. So, so they did an IV push, and I had a reaction to it, and it completely stopped my heart. Had my aunt not been there, I'd probably not be here today, which is true. At the time, my aunt was a nurse at the hospital and was head of the cardiac wing, and seeing as though I had a chart at the hospital and she was listed as a relative, so that's how they went and got her, or called her, or whatever, my heart ended up stopping. It was completely dead. I was completely dead. It took them a little over 3 minutes to get my heart started again. And this isn't a good thing because it causes other complications besides brain death. And I'm also prone to blood clots, so that doesn't help. And I had a pulmonary embolism when I was 15, which is for those that don't know, they call it a PE, or a blood clot in your lung. And so they worried about potentials for those kinds of things. When I was alive, again, they finished what they had to do. I wasn't conscious again after that. I was conscious up to them doing the IV push, and that was it. I don't remember anything for like a week after my heart attack. So I was like completely out of it. And if I didn't have the notes from my doctor's recollections in my charts that I have here, I wouldn't remember most of it. So that's kind of scary. Okay, so they moved me to the ICU after my heart attack. Now we're getting into the stroke. While I was in the ICU, I had a stroke. So about 12 hours after my heart attack, I got a blood clot. The nurses didn't catch it. Again, it's not something that you can see. And I ended up stroking out while in ICU. The type of stroke that I had is called an ischemic one. And I will pull up one of my mini links so I can read you the different types, because there are several different types of stroke. Most ischemic strokes are caused by plaque buildup, or usually like clogged arteries and that kind of thing due to like high cholesterol and stuff like that. I didn't have any of those kinds of issues, and usually it's also caused by high amounts of stress that cause the plaque to like break off and then chunk up and then get stuck places. Other than the stress of the fact that I had already had, I'd had a heart attack, that I wasn't conscious, so physical factor, external factor, stress didn't factor into my stroke. It was, if stress was related, it would have been done strictly by the fact that my heart was weakened. So it was enough to cause a stroke. I had a blood clot blocking blood flow long enough to my brain that caused my stroke, and it affected the entire left side of my body, my left side of my face, my arm, my leg, things like that. So, getting into types of strokes really quick. Ischemic stroke is usually caused by clots. It occurs when blood vessels supplying blood to the brain is obstructed, and it accounts for 87% of all strokes. So, it's the most common form of strokes. Then you have a hemorrhagic stroke, which is usually caused by bleeds or bleed outs. It occurs when weakened blood vessels rupture. The two types of weakened blood vessels that usually cause a hemorrhagic stroke are an aneurysm, which is again what I was talking about when you have a blood clot in an artery. Usually the pressure of it pushing on the side of the artery is too much for the artery to handle, and it goes pop. My friend Ken suffered from that. He's got a massive scar down his neck from his aneurysm, and they did a pretty bad hack job getting to his brain. But his aneurysm was caused by a TBI, a traumatic brain injury, based on his time in the Marines and head injuries and lumps and bumps that he got while he was serving the United States military. Okay, so hemorrhagic strokes are aneurysms, and AVMs. I'll leave it on the screen. I can't talk today. The most common form of hemorrhagic stroke is uncontrolled high blood pressure. I have low blood pressure, so thankfully I don't have to worry about that. Then you have a TIA, which is a transient ischemic attack. It's called a mini stroke. It's caused by a serious temporary clot. This is a warning stroke and should be taken seriously. So usually you'll find this in like older people. They have like a mini stroke where they need to be put on blood thinners and that kind of thing. So, or if you find, people that are older that have all the like bruising and stuff up and down their arms and skin discoloration, it's usually because they're having problems with blood clots and they need to be put on a blood thinner in order to thin their blood out, because it's kind of like the difference between water and Jello. Yeah. Then you have the cryptogenic strokes. In most cases, a stroke that is caused by a blood clot that blocks the flow of the blood to the brain. In some instances, despite testing, the cause of the stroke cannot be determined. It is, the next one is a brainstem stroke. It says when strokes occur in the brainstem, it can affect both sides of the body and may leave someone in a locked-in state. When a locked-in state occurs, the patient is generally unable to speak or move below the neck, so you're basically paralyzed. So there's a few other types of strokes, and some of them are more rare than others. But just in general, the hemorrhagic and the ischemic ones are the two most common types of stroke, and I have to stop. I have officially killed my Canon battery, and that records for like 2 hours usually without fail. But I did record a half an hour for my makeup look and 45 minutes for the part 1, and part 2 is probably about half an hour long right now. So yeah. Okay, so for me, what my stroke felt like, and this was like after effects, because again, I wasn't conscious when I had my stroke. So there was no slurred speech, there wasn't slow movements, there wasn't dizziness, there wasn't passing out. I didn't have any of those because I was already unconscious. I could feel like, you know, when the doctors, they take like a pen or a pair of scissors or something, and they run it along your skin, and then they poke you with it. Number one, usually it's metal, so it's cold. So they do this to see if you can feel it, and then they poke you with it to see if you can like feel not only pressure, but whether or not it's sharp. I could feel that on the left side of my body, but I couldn't move anything. So that was a little bit odd, because usually with stroke victims, you can't feel jack. So I still to this day don't know why I had some sensation, but not everything. I've been to a few neurologists, and none of them have been curious enough to look into it. So I'm just gonna wonder until I find a doctor as curious as me to actually ask the right damn questions. Okay, so I could feel cold and sharp and pressure on the side affected, but I could not move. I could move nothing. I could not open or close my hand. I could not wiggle my toes. My knee jerk reaction was dead, you know, where they take those little rubber triangles and bunk you in the knee. Mine didn't work. Let's see. I had zero sensation on the entire left side of my body. My speech was slurred and thinking was foggy, and I'm a linear thinker. So that means that I think usually with the left side of my brain versus the right. I am very logical and analytical in everything that I do between my actions and my thoughts. And after my stroke, I felt dumb. Like I couldn't think. I couldn't form conscious, coherent thoughts. Just the smallest action, like turning my head, was near impossible. It felt like I had a lidocaine shot from the dentist put in my head an entire side of my body. It was like I was just waiting to drool on everything. And that's true. I mean, I couldn't do this. I couldn't do this. I had to do this because I couldn't control the muscles in my neck or my face. It was bad. Let's see. So it's because my left side was essentially gone. My thinking was slow. Speech was non-existent. Cognition was hazy. And again, why did I not catch that typo? It says Maisie. Like Maisie Williams. Anyways. It was hazy at best. Even my vision was impaired. I spent 2 weeks in the hospital after my health issues. And by the time I could stand on my right leg, at the time I could stand on my right leg, but I had no movement at all on the left side of my body. So like I was weight bearing on the right side, but my left side was like, you know, there was like no controlling it. So of course they wanted to do physical therapy and shit like that. So that was something else that I'll have to get into. So I could stand on my right leg, but no movement at all in the left side of my body. It was like completely dead. And it was like unresponsive. It was just a weight hanging there. I could not wash properly. I could not get dressed without help. Eating was tough. I finally got some mental capacity back but I was still pretty messed up. I ended up getting a wheelchair to become mobile, because without it I was stationary, and I couldn't walk. And you can't use crutches because you kind of need both working wings. My daughter was a huge help, even though she was little at the time. Oh, and that was another thing. I started having seizures like multiple times a day. Like I would have up to 20 seizures a day. I was on so many medications that I'm surprised that I still have a liver, and I am still very surprised I have a liver after everything that they've put me through. But I'm just very glad that I've never drank, so I still have a liver, and it still works. It took me months to gain feeling back, and to gain any feeling back in that side of my body. It took me probably a month to get my eyes to focus on things, to be able to like turn my head was like a feat. I pushed hard every day and was trying to massage things to get the muscles to react. I was probably about 100 pounds, maybe a little more, a little less, give or take. At this point, I was unable to move my arm or my leg without assistance. So this was a lot of what I had to do. Like if I sat down, I would do this with like my pant leg, and I would drag my leg around by my pant leg. And there's times when I still do that because unconsciously I just kind of grab my clothing and just, you know, it's just because I did it for so long that it's kind of like unconscious at times that I just do that. I was unable to move my arm for the first 4 months, and then my legs started working again about 8 months in, but it does not mean I could use either of them. It took me a full year after my stroke to grab anything with my left hand. Like this was an accomplishment. This right here was like a huge feat. And it took me a full year after my stroke to do this. Something that you take for granted every day. Just the simple fact of holding something was like beyond me for the first year after my stroke. And about a year and a half is when I was able to stand up and be weight bearing on my left leg without having to hold on to anything, without having somebody else steady me, without me having to move my leg with my arm in order to get it to move, that kind of thing. So it was rough. And then we get into kind of the emotional toll of it. It says, I felt helpless and alone and angry all the time. The doctors ran a bunch of tests and could not figure out what caused the heart attack. My husband told me multiple times, I wish you would just die already. My daughter would help me shower and dress, and by this time I was living in the middle of nowhere in northern Marion County. We were living in Citra, and my ex-husband had secluded me away from everybody that I knew and cared about. I had no phone access, no internet. I was literally in a single-wide mobile home with my daughter day in and day out, and my husband would just leave and go wherever and not come home for multiple hours. Whether he was working or not, I don't know. I don't know how rent was being paid. All I know is that I was in a wheelchair, and I basically lived in 2 rooms of that house because I couldn't get down the hallway because the hallway was too narrow. I was in like the living room, kitchen area, and then my bedroom, and the master bath, which was adjoined to the master bedroom. And that was the only areas of the house that I could get in and out of. Let's see. Oh, and the bad part for him, I guess, is that he finally realized that I was no longer paying my life insurance policy. So even if he had tried to kill me at that point, he'd get nothing. Not a damn cent was he going to get. And the policy had lapsed on my daughter as well, so he wasn't going to get her insurance policy either. He still hit her in the damn head with a hammer, but he didn't get a dime. Didn't kill me, didn't kill her. I'm surprised it didn't kill her. And that's a story for a whole other video. That's why I went to jail. He hit my daughter in the head with a hammer, and I went after him. So, yeah. But yeah, he found out like months after I could walk again, that there was no insurance policy. And he like lost it and got violent. And so one thing led to another. But again, that's a story for a whole other day. Okay, now general information about strokes. Everybody is different when it comes to strokes, just like when you have a heart attack. If you are male, they say that you experience symptoms mainly on your left side. And if you're a female, it usually affects your right side. But this is not always the case because there are several types of strokes and bunches of mitigating factors that go into this as well. You really have to pay attention to like the key factors, and I have found that talking with other stroke survivors, lethargy is one of the things that they noticed: confused thinking, slow movements, changes in attitudes and dispositions, things that you have. Then you have the common stroke symptoms, which are dropped or drooping arms, can't pick up your arms or hold it up, slurred speech and cognitive difficulties, and usually impaired vision. So, I'm surprised. I don't know how long this is. This is part 2, episode 1, part 2, discussing strokes. Again, all of this information that I have read off, my story and Amanda's story will be, I'm going to copy this from Microsoft Word after I corrected the 3 or 4 spelling things that I found in here that were incorrect. I will copy it and paste it into my blog, and this will be included in the description box, as well as the links to the conditions that Amanda has, a few different websites on strokes, the conditions that I've been diagnosed with, be it the heart attack or the lymphadenopathy. If you have any questions about strokes or any of the things that I have talked about and you want me to explain it in a little bit more detail, or you need help looking up research, leave a comment down below. I will leave links to resources as a reply, or I can do another like Real Talk with Rebecca video and do a breakdown on those. Again, like I had stated in my intro video, I don't know how long these are going to be. Sometimes I might get kind of going on a topic and I might have to split it up into 2 parts like I did with this one. I didn't realize how much I actually wrote about Amanda's story before I mean, I know how much I wrote. I wrote it this morning, but I didn't realize that how long it would take me to talk about it. So I'm going to have to keep that in mind when I'm writing a 4-page report, that it's going to be at least 2 parts. So if you have topics that you would like to hear me discuss or go in depth about or do research on for you, or if you're just curious about certain things, it doesn't have to be health related, then leave them down in the comment section below. Also, give this video a thumbs up. And comments do help, as well as the thumbs up button. But, you know, I'm hoping that sharing some of this information, not only about my own personal experience, but general information about strokes, and what people can go through, what their experiences are, and leaving resources and stuff like that down below. Maybe it will help people recognize the symptoms of stroke, the effects of stroke, how hard it is on a person from one person to the next. And you know, Amanda's still going through this stuff, and she's still having stroke symptoms every day. And you can have repetitive strokes. You don't just have like a wham bam thinky man with a stroke. Sometimes you have more than one. And depending on the severity of the strokes, it can cause some serious brain damage, between broken pathways and misfiring neurons, or blood vessels that are either enlarged or some that shrink. I mean, there are so many different things that can happen. And again, your brain is like your computer's hard drive. It stores all of your information. It controls speech and vision and movement and smell and sight, hearing. It like tells our autoimmune system to turn on and turn off. It tells our heart to beat. I mean, it allows us to breathe, allows us to wake up every day. Our brain is so important in our body that when you have a condition like a stroke that affects the way that our brain fires, or doesn't fire in some cases, it can be very scary. And if you've ever suffered from a stroke, or you think you've suffered from a stroke, please seek help. They're not fun. Trying to survive a stroke, trying to get right after a stroke, all of the hard work that you go through, the pushing, the relearning how to do shit, the mundane and pedestrian things that we take for granted that you don't have the luxury of doing after a stroke. It's just so impactful that a physical therapist can teach you how to do step A, B, and C, but you have to do step A, B, and C, and you have to force yourself to do those steps. You have to have the capacity to do it, the willpower, the mindset. It really is a mind over matter when it comes to surviving a stroke. You have to put all of your willpower, all of your heart, all of your everything into getting better. Because if you push it aside, if you brush it aside, you're going to get worse. You're not going to get better. You're going to stagnate, and then it's going to do damage. You don't want to do damage, but you also don't want to push yourself too hard to where you're going to cause yourself damage. So knowing what the happy medium is into too much or too little is also key. You need to listen to your body. You need to be self-aware of you and how your body works. And I know saying this seems like it's easy, but there are people that have absolutely no clue about what their body does on a daily basis. They get a headache, and they just think it's a normal everyday headache, when in all reality it was an aneurysm and it's a blood clot that's killing them little by little, and they just take a couple of Tylenol or an Advil or an Aleve or whatever, and they just sweep it under the rug. They ignore their body, and then they have other red flags and signs and symptoms that pop up that most people would be like, the house is on fire, get out. And they're like, it's just a little cloudy today. There's no big deal. It looks like smoke, but yeah, it's just a little overcast today. It's a little cloudy, when the house is literally burning down around them. Okay? Your body is your home. You live in this every day, all day long. So you need to make sure that your water pipes are working, that your gas is on, that your AC works the way it should, and nothing is misfiring, and everything is in good condition and working. All it takes is one leaky pipe, and you'll have a condition like I do called a mitral valve prolapse, where when your heart chamber is supposed to be empty, your blood leaks back into an empty valve and causes regurg and causes your heart to go ka-thunk. Not the thump. Not the thump, but ka-thunk. So, listening to your mind, listening to your body can be a very, very good thing to do. Sometimes it is in those still, quiet moments where our body will speak to us, and we have to pay attention in order to learn red flags. I don't want to get philosophical here, so I'm going to go ahead and stop this here. I'm Rebecca Oberstadt. Thank you for coming to Real Talk with Rebecca. This is episode 1, part 2, discussing strokes. Hopefully you guys have learned something. I will see you in tomorrow's video. Have a great day or night, wherever you are.